Now welcome to have the talk on once again where we have left yesterday's topic on pectoral series of muscles. We finished in our last episode skin and superficial fasciae as well as deep fasciae and the pectoralis major muscle. But now today, in continuation with that episode first, under the heading of pectoral group of muscles, we will talk on the what that is the pectoralis minor. Now this pectoralis minor, to understand, once again you should have that of the thoracic cage diagram, which will be there like this. You will be having this clavicle, the same yesterday's diagram, but you will be having this is the glenoid cavity, this is the coracoid process. Now here it is the water that of the glenoid cavity, this is the coracoid process, this is the clavicle. So this will be the first rib, this will be the second rib, this will be the third rib, this is the fourth, this is the fifth, this is the sixth, this is the seventh, this is the magnum part, this will be the part. So that pectoralis minor muscle is almost all it is present just behind the water that of the pectoralis major, and this pectoralis minor muscle, which is triangular, small but thick compared to the pectoralis major. This you can say pectoralis minor. Pectoralis minor. It forms the bed of the breast along with pectoralis major, deep fascia of the pectoral region, as well as the water that of the retro-mammillary space. It also helps in order to divide the axillary artery into three parts, that is proximal, middle and the lower part. This you can say pectoralis minor muscle takes origin from the water that of the second rib, second costal cartilage, small portion, third rib, and that of the you can say and small anterior part of that of the third costal cartilage, fourth rib, and that of the small portion of the water that of the you can say fourth costal cartilage. Then sometimes it will be also going to take origin from the anterior surface of the water that of the fifth rib and that of the fifth costal cartilage. From that, this you can say pectoralis minor runs upwards towards laterally towards the water point of insertion on the anterior surface of the body of coracoid process of the water that of the scapula. While it is running so, it divides that of the axillary artery into three portions, one which will be there earlier to this, another will be there second behind this muscle, and the third part will be there below to this. So this is the pectoralis minor. Now this pectoralis minor muscle, after having had its origin insertion and its placement. It will be having the relations. Now if you take the water relation of the water, that is the pectoralis minor, this is the pectoralis minor. Now this pectoralis minor in the front, it is related to the water that of the skin, superficial fasciae. This is the superficial fasciae. Then you have got the water that of the mammillary gland, or the breast. Then you have got the retromammillary space. This is the retromammillary space. Then the deep fascia of the pectoral region. Deep fascia of the pectoral region. Then you will be having what is said to be as here the muscle. This muscle is called as what? Pectoralis major. What will be there? You will be having behind to this. Behind to this pectoralis minor, there will be a what that of the, you can say, ribs. Those ribs are varying from that of the second to what that of the fourth rib, and the what that of the successive or ribs between them, second to the what fourth. There you can say successive intercostal spaces. Then you will be having a muscle. That muscle is called as what is said to be as a Serratus Anterior muscle, and the space between the what that of the ribs, which is said to be as the what intercostal space, the content of the intercostal space. So these all things it will be there behind. So this is what the thing. As the origin is even from fifth, you will be going to have the fifth rib also with its costal cartilage. Here also you will be having the costal cartilage of the water respective from second to the water fourth. So this is the relation of the water that of the pectoralis minor. Now once this relation is over, you have to go to the water nerve supply. Nerve supply for the water pectoralis minor, it is by the water cervical spinal nerve 6, cervical spinal nerve 7, and the water cervical spinal nerve 8 via brachial fluxes with having a name as medial pectoral nerve and the water lateral pectoral nerve. So the pectoralis minor is taking a nerve supply or from medial and lateral pectoral nerve from the what medial and the lateral cord of the water that of the brachial fluxes, which will be going to derive from this 6th, 7th and 8th root values of the cervical or the neck spinal nerves. So now what is the action? Action of this you can say pectoralis minor, it is nothing but definitely it is what one of the water respiratory muscle, because it will be going to take origin from the water that of the second rib to the what fourth or third, fourth and fifth sometimes, and their costal cartilage is very small portion. So as because the ribs and the costal cartilage are moving, it will be coming into an action of the water respiration. Respiration. It is the one respiratory. Either it comes into the water expiratory or it comes into the water inspiratory. Then you will be going to have the water another action. Action of this is the water flexion of shoulder joint. Flexion of shoulder joint. So this is the main two. And this you can say pectoralis minor acting along with the what? That of pectoralis major 2. Now you will be going to have the what? Another muscle. That muscle I can draw it on the other side where you can see it more better. So that will be the what? This is the first rib. So from there will be about one muscle like this. Now this muscle is called the what? Subclavius. Subclavius. Now the subclavius muscle is what? It is one of the muscle belonging to the what? That of the pectoral series, or the muscles that which connects the thoracic cage to the what? Upper limb bones, maybe to the what? That of the, where you can say clavicle, maybe to the what? That of the, you can say humerus, maybe it will be there for the what? That of the scapula, but they are the what? Bones of the upper limb. So this where you can say subclavius, it is present in the series with that of pectoralis major and the pectoralis minor in the pectoral varieties, but it is a small triangular muscle which will be running from the water that of the superior surface of the first rib and runs upwards towards laterally to get attached or to get inserts on the water inferior surface of lateral one third of clavicle. So it is inserted. The origin of this muscle is on the superior surface of the water, that of the first rib. Insertion is to under surface or the inferior surface of the water, that of the lateral one third of the clavicle. Now this subclavius muscle, as it is present in between the rib and the water, that of the clavicle, so this muscle will be going to get invest in the water, that of the deep fascia, which will be present in the water clavicle and the water, that of the pectoralis minor, which will be superior flap and inferior flap of the water, that of the, where you can say cervical fasciae, which will be continuing as the water clavipectoral fasciae, and then pierces the water clavicular fibers of the water, that of the pectoralis major. So there it will be present in that. Now this you can say subclavius muscle relations. You will be having the skin will be there, superficial fascia will be there, superficial flap of the water, that of the deep fascia of the neck, and the water, that of the deep flap will of the water, that of the deep fascia of the neck, which will be there behind. Then it will be running in front to this is the water clavipectoral fasciae. Now what is the thing? It will be there behind to this. Behind to this, you will be having a small portion of the what deep flap of the water, that of the deep fascia of the neck, and the fat and the water fasciae. So that will be there. Medially, it will be having the water, that of the sternoclavicular and this sternoclavicular and the water sternocostal joints. Laterally, it will be having what is said to be as under surface of the what lateral one third of the clavicle, where that groove is there, subclavian. Now this subclavius muscle, nerve supply, is a nerve to the subclavius, which is derived from the cervical spinal nerve 5 and 46. These are the supraclavicular branches of that of the, where you can say, brachial plexus. Now after having had this, what is the action of this subclavius? Action of the subclavius is nothing but the what? Depression of shoulder joint with forward movement of shoulder. So it is nothing but a depression and the what? Forward means flexion of the shoulder joint or forward movement of the shoulder joint. Apart from this subclavius muscle, it acts along with the what? That of the latissimus dorsi and the teres major. So this is what the second. Third, fixing the clavicle to thorax and upper limb. So this is what the third action. Now apart from this, you will be having what is said to be as the next muscle in this pectoral series. You will be having, that is serratus anterior. Now this serratus anterior, as the name itself suggests, it will be having the 8 teeth or the 8 digitations just appearing like a saw for teeth. Now this serratus anterior is named because of that appearance. Serratus anterior, it is belonging to the what? The pectoral series, which is similar to that of the preceded 3 muscles, such as pectoralis major, pectoralis minor, and the what? That of the subclavius. Now this serratus anterior muscle, it takes origin from, or it will be almost all, it is the broad sheet, thin, and this muscle will be going to surround the what? Thorax in front, laterally, and then behind. So you have got the 3 directions for this muscle. Now this serratus anterior muscle, it takes the what? That of the origin from the what? Upper 8 digitations of the what? That of the serratus, the upper 8 digitation of that of the ribs, or it will be taking origin from the what? That of the ribs 8. Those are the upper 8 ribs. From upper 8 ribs, this here you can say serratus anterior muscle, it takes origin in very many directions, and it will be running in 3 phases. One is laterally, then behind, and then towards medially, so as to encircle, so as to cover the thorax by all means. Now this serratus anterior, after having these 3 directions, it will be going to get inserts on. It will be going to get insert on the what? That of the anterior surface of the medial border of scapula or the vertebral border of scapula. Now so if it will be like this course of this serratus anterior, it is having a relations in front, skin, superficial fascia, mammillary gland, and that of retromammillary space, and you will be having pectoralis major, pectoralis minor. Apart from that, the deep fascia of the pectoral region, this will be in front. That too anterior aspect. Behind in the anterior aspect, you will be having a pectoralis. Only that will be having a ribs, intercostal space, content of the intercostal space. But the same is not true for pectoralis minor. Behind relation of this, you will be having serratus anterior. It will be there here. Remember? So those are the things. Now what is the relation of the serratus anterior in the lateral part? In the lateral part, serratus anterior is related to not in front and behind, but it is superficially and deep. Superficially it is related to the skin, superficial fascia, deep fascia. Then deeply it is related to that of the, you can say, ribs, upper eight, and the intercostal spaces, content of the intercostal space. Now the posterior portion relations, superficially and deep, skin will be there, superficial fascia will be there, deep fascia will be there, the scapular region muscles are there. This is what superficially. Deeply it is related to, serratus posterior superior, serratus posterior inferior, and the intercostal space, content of the intercostal space. So like that it will be the thing. Now what is the nerve supply for this serratus anterior? What is the nerve supply for this serratus anterior? What we put at? Serratus nerve supply. Nerve supply for the serratus anterior is by the long thoracic nerve. Now this long thoracic nerve is also called as the what? Nerve of Bell. Now this long thoracic nerve root values, you will be having what is said to be the C5, C6, C7. C5, C6, C7, which will be going to form as a what? Long thoracic nerve. I will write it here, long thoracic nerve. Now this long thoracic nerve, it is coming from the what? Posterior cord of the water, that of the brachial plexus. So this is what the thing you will have. Now what is the action of this? You can say serratus anterior. The action of the water, that of the serratus anterior, as you know, it will be the what? Encircling the whole of the thorax. This serratus anterior, first it is a what? Respiratory muscle, that goes without saying. Then this, you can say, serratus anterior muscle has got also the action, that is rolling movement of the water, that of the scapula, especially in embracing of anyone who you have met from very after quite long time. Especially you can get into the water, aerodromes, railway station, when you met your friend after a long time. This is, or to embrace of your near and dear ones. At that moment, this serratus anterior will be going to fall into. This is the thing. Now, after having had this talk right from yesterday's episode 1 for the water, the muscles that which connects the thoracic cage to the upper limb bones. You have finished pectoralis major, you have to finish pectoralis minor, you have finished the what? The subclavius, you have finished the Serratus Anterior, today 3, yesterday 1, with the skin and the water superficial fasciae, deep fasciae also. But what you have to remember is, now these pectoral group muscles are the muscles that which connects the thoracic cage to the what upper limb bones. They are the main respiratory muscles because they are taking origin from the water ribs, costal cartilage and the water sternum, including that first rib. Insertion will be there on the upper limb bones. Action will be the water respiratory apart from flexion of shoulders and depression along with the water, some other muscles which assist that action of that muscle. Okay, so this is what one must know. Now the nerve supply for these 4 muscles: pectoralis major, medial, lateral pectoral nerve, having a root values, you know it, 5, 6, 7, 6, 7, 8 and T1 major. For pectoralis minor, you have got the water, that of the, you can say 5, 6 and 7, 8 is excluded, root value. For subclavius, you have got the water ranging 5 and 6 nerve to the subclavius. But serratus anterior, if you have considered, you will be having long thoracic nerve coming from posterior cord of the brachial flexus, having a root value 5, 6 and 7. That is called as a long thoracic nerve. It is also called as nerve of Bell. Nerve of Bell. Bell was an anatomist. So now the thing is what is the applied anatomy for this pectoral varieties? Now when there will be any of this spread of the infection from the that of the, you can say, mammillary gland. Backward, it involves right from retromammillary space, pectoral fasciae, the fasciopectoral region, pectoralis major, minor, serratus anterior, even goes into the rib if it is in the malignancies and all, and even it goes to the piercing the thorax, intercostal space, goes into the either lung or it goes to the dam. So how the spread, that is known. Second, applied anatomy. This you will know, serratus anterior is inserting on this. If lower fibers are cut off of serratus anterior, this you can say scapula will be going to wing out laterally like a wing of a bird. So that is called as a winging of scapula. Winging of scapula. This also happens when there will be a damage for long thoracic nerve. At that moment there will be a at the time of respiration and at the time of when you will be doing a embracing action, that is rolling movement of the scapula, it will be going to stand out. So this is what the applied anatomy of these pectoral varieties in connection with the diseases of the breast or the mammillary gland, mastitis or cancer, or the another name for the cancer is the cancer of the malignancies of the mammillary gland. So these are the things that what you should know for the undergraduate level. Thank you for hearing patiently that talk which has been left incompleted yesterday. Yesterday is episode 1, today is episode 2. Thank you.